Well, welcome back to Interview with the Giants with Don Gatling and Gino Franti. For over 6.5 years now, we've had the Don and Gino Real Estate and Finance Show, basically with our goal of guiding you to personal and financial wellness. Now we have Interview with the Giants with our goal of interviewing some of the top professionals all across the country to help inspire you in multiple ways. These are not just going to be the normal names you always hear. It will be some of them, but there'll also be some like you and I, passionate people that are trying to reach out and help as many people as possible. And today, Dr. David Almeida is one of those.
Yeah, and you know, Don, part of the thing about being an entrepreneur is there's so many different layers of it, right? When you just first start a business, when you're 2 years into a business, when you're 5 years into a business, when you're 10 years into a business, it's constantly evolving. And as David has, you start branching out and you want to start helping people. You want to start helping other people not commit the same mistakes you have. You want to start helping people grow at a faster curve, right? So they're not having to suffer like you did. And that's how I think the country gets growth. That's how our world continues to grow, rather than just one step at a time repeating the same mistakes.
Wow, very deep, Gino. Nicely done. Wow. Okay. Well, that note, we're gonna reach out to our guest again, Dr. David Almeida, and we're gonna dive in a little deeper about David's background and some of the things David's been working on. His fields are toxicology and ophthalmology and so much more. But what inspired you to even get into that? Did somebody sock you in the eye or something? You said, "That's it. I'm gonna be an eye doctor."
When I was going through medical school, the eye surgeons always seemed to be really enjoying what they were doing. They kind of enjoyed their surgery and they enjoyed their clinics and their patients, and they found it rewarding. And a lot of the people in the hospital seemed really bitter and cynical about their life and unhappy in their station. So, and naturally I gravitated to that side and really found the surgeries really fascinating. The potential for therapeutics in the eye is really, really massive because we haven't had drugs for eye diseases for a long time. So those two factors really combined to drive me that way.
You know what I think is interesting about that, and I don't know enough about the drugs that you've helped develop, but I know that one of the things that happens is eyesight gets affected by diabetics. And with diabetes being such a big problem in this country, I'm assuming that you have to deal with that type of eye loss.
Yeah, that's one of the major, most common diagnoses I see all the time. Yeah, with people with severe bad diabetic retinopathy or diabetic macular edema that I treat, dozens of times a day.
Well, and then we can dive into, Gino, you had a really good question regarding, just the drugs that we have, because you said basically in our first segment about that you do drug design. And of course, all of you out there that are like, ooh, what kind of drugs? Not those. We're talking basically to help you not in the way you're thinking, basically. But you do drug design differently, meaning instead of just utilizing one drug to treat one symptom, you actually put together, I guess, a Citrus Therapeutic?
Yeah, Citrus Therapeutics was founded by myself and my co-founder, Dr. Eric Chin, who's in the Los Angeles area. And so to the point that when Gino and I were talking before, that right now, drugs are very much a single target thing. You find one target and you attack it. And you can drive that to a certain point, but you start getting a lot of adverse events. And what Citrus Therapeutics was about a new approach to drug design, where we design multi-pharmacophore active drugs, or drugs with multiple structure-activity relationships, so that you can, in essence, get multiple effects, affect multiple targets with one drug. The idea is that by having these multiple mechanisms of action, you'll get more efficacy while having less adverse events, less complications at the same time.
So I don't know if this is a good analogy, but as Don likes to call me, analogy boy, it's not the same to take a pill that has vitamin C in it as it is to eat an orange, because the orange has a complete structure that affects multiple systems.
Absolutely, exactly. You're going to get more, you're covering more bases, more potential targets, exactly.
Okay. Well, the reason that came about is we were talking offline about most traditional Western drugs are not very effective. And although, like, Lipitor is my favorite one to pick on, although it lowers cholesterol in everybody, it doesn't necessarily lower the potential for a heart attack. And so it doesn't necessarily treat the underlying risk factor.
Yeah, I think trying to maximize the breadth of disease that you can treat while minimizing and really getting to big outcomes like it is an important point. And I think there's been, sometimes lots of frustration. I know for me from the drug design aspect with some drugs that you really come up a wall soon because they have one mechanism of action, and you can get into having lots of negatives before you see a positive real soon.
So what about the process of, I can imagine it's a tedious process to actually get a drug approved in this country. So that's got to take some resiliency and some determination as an entrepreneur and investment capital to say, I'm going to stick with it because I believe in this drug.
Yeah, that's a good question. Citrus Therapeutics in its current form exists very much as an idea creation or a lead generator, where we can come up with a new drug, we define its targets and what it can treat. And then once you get to the preclinical aspect, we try to bring in funding, try to bring in investor support to take that next level. And then we're more than happy to hand off those lead candidates to the big pharma companies who have the distribution and the synthesis and know how to do that. But I feel like the ability to innovate at our level is really unparalleled because we're just essentially two guys that really thinking all just about this new way to design rather than being sometimes hampered by a big machine that has bureaucracy and multi-levels in it.
And if you're just tuning in, we're here with Dr. David Almeida, basically one of the top toxicologists, ophthalmologists. He's helping renew eyesight. Also a businessman, entrepreneur, blog, author, speaker, all that. And he's with us on the Interview with the Giants, sharing his passion, sharing how he's making a difference in a lot of our lives, and sharing also how to focus. I mean, one of the things that I see with all your stuff is you're really good about staying focused and passionate. What do you attribute you're keeping that kind of energy level up?
Yeah, I think time management helps them, and sometimes that's kind of a funny answer. And I get some blank stares because like that's such a boring topic. How do you get passionate? But just approaching tasks in an efficient way so that you can manage your time effectively. I find that very you become very grateful for that because then you can do or solve the problems you need to without being totally bogged down for them or being haphazard and scattered for them. So I used to always have this thing that if I had 20 minutes or more, you use that to do something productive or constructive or creative with it. You just didn't waste 20 minutes. If it was less than 20, you could waste it. But so that approach, that if you have some time, use it for something. Like I said, I really enjoy playing guitar as a hobby. If I sit down and play guitar for a little bit and just be always trying to stimulate different creative aspects. I think going back to what we said at the beginning, keep putting yourself in uncomfortable positions and you learn a lot about yourself, what you like and don't like, and you'll be surprised at how willing you are to adapt to new situations and what that brings out in you.
So you mentioned one thing earlier. You talked about maybe learning and that you might have touched on the distinction that I have a difficult time with myself. My parents gave me tremendous work ethic. Nobody can ever doubt the amount of hours I'm willing to work. Now, maybe they were lacking a little bit in the discipline department. It sounds like you kind of got a good balance of both, quite a bit of discipline along with that work ethic.
Wait a minute. Gino's jumping ahead on us, I think. I think we need to talk about, you're teeing up, I think, our next segment about the decision diagnosis.
All righty.
By Dr. David Almeida.
Well, our conversation just took us there, Don.
So we're going to take a quick break. When we come back, David and mine, if we dive into your book that you are helping so many of us become more efficient and focused on?
No, sounds wonderful, guys.
All right. Again, we're here with Dr. David Almeida, MD, and so much more. You can find out more. Is it davidalmeida.com or davidalmeidamd.com?
Yeah, davidalmeidamd.com. Everything goes through the website, so you can find the blog there, the book, and what's going on the research front, and has links to the Citrus Therapeutics webpage and what's going on the pharma side.
Nicely done. Plus, a good-looking man. All right, David, when we come back, we're going to dive into your book. And don't go away. This is great stuff for anyone, especially if you're an entrepreneur or a businessman. David's got some things that are going to change your life, and I'll read some of the reviews that back that up when we come back to the Don and Gino Real Estate and Finance Show and Interview with the Giants.